is Mahasin Mujahid, and I'm an associate professor in the Division of Epidemiology at UC Berkeley. And we are here to have a conversation about a session that we just had at Epi Lifestyle entitled Social Determinants and Health Disparities. And we're going to discuss one abstract that was presented, association between acculturation level and cardiovascular risk factor prevalence among Asian American subgroups. This was presented by a graduate student from Emory University, Molly Lee. And here to discuss the findings, we have Dr. Eugene Yang, a senior investigator on the study. You want to introduce yourself?
Yes, thank you. Yes, my name is Eugene Yang, and I'm a professor of medicine in the Division of Cardiology at the University of Washington.
Thank you so much for being here. So to start, can you tell us the main findings from this abstract?
What we found was that higher levels of acculturation was associated with a higher prevalence of specific cardiovascular risk factors, such as obesity, hypertension, hyperlipidemia. But we also found that there was significant heterogeneity that existed between the different Asian subgroups, a conclusion that we thought we would see, but something that has not been well studied.
Very interesting. So can you talk a little bit about why it's so important to not only focus on Asian Americans, but also to focus on the heterogeneity within Asian Americans, something that doesn't often happen in the literature?
Yeah, so I think as a cardiologist, we are, in a challenging position where we have difficulty trying to estimate accurately cardiovascular risk for Asians. So first of all, there is no specific risk calculator. But beyond that, when we look at the differences in cardiovascular morbidity and mortality, we know that certain Asian subgroups like South Asians are at higher risk for cardiovascular events, whereas East Asians are at lower risk. And so without having disaggregation and better understanding this, we may be over-treating certain Asian subgroups like East Asians and potentially under-treating other subgroups like South Asians. In the context of our study, what we found was that acculturation, higher levels of acculturation seem to differentially affect some of these risk factors that were prevalent. So for example, Filipinos had higher rates of obesity and tobacco use associated with higher acculturation. And South Asians, on the other hand, while there was higher rates of cholesterol, there was no influence on something that's very important to cardiovascular health, specifically physical activity. So this paper really gives us an opportunity to start thinking about how do we target specific interventions for specific Asian subgroups. So perhaps for South Asians, we encourage more physical activity to attenuate cardiovascular risk in that population. And for Filipinos, we work on smoking cessation, we work on dietary and interventions and weight reduction programs that are specific to that population and also culturally specific.
So can you provide some suggested impacts of your findings? What do you think this study motivates in terms of future research? And how can this inform our efforts on cardiovascular prevention?
Yeah, I think that, this is really a very superficial foray into diving deeper into understanding some of the differences in cardiovascular risk factors among Asian subgroups, because not a lot of literature has been published on this. So I think it really exposes this to, the broader audience, that there's a need for more research that dissects out and disaggregates Asian subgroups. And finally, most importantly, that really these types of studies are really needed to better understand and inform targeted culturally specific interventions to improve cardiovascular outcomes.
Agreed. And all of that is just so important, especially as we think about our AHA strategic impact goals. So thank you so much for sharing the results of that study and leaving us with some really fruitful directions in terms of future research. Thank you.
Thank you for inviting me.